Good morning. My name is Gar Atchison, Market President for UP Health System and CEO for UP Health System Marquette. And thank you for tuning into our first community town hall meeting. Our main focus at this time is to take care of patients, our employees, and to help prevent the spread of COVID-19. Our hospital has been preparing for weeks in advance of this. We have a command center that meets daily, 7 days a week, and a 24/7 command center hotline for internal questions and concerns to be brought forward. Our command center has multidisciplinary team members, including physician participation, as we prepare for every possible turn of this event. Addressing our personal protective equipment, the hospital has currently a strong supply of PPE for our staff and physicians. We are, like every hospital, working to conserve the PPE and looking at how to reduce the burn rate, which really led us to the decision to cease doing all elective procedures in the facility. The hospital is under a zero visitor restriction policy to protect both the community, the patients, and the staff here at UP Health System. We've also recently increased our screening process for everyone entering the building, including taking forehead temperatures of all employees, physicians, and visitors to the facility. We are collaborating actively with all of the 13 hospitals in the UP to create a regional approach for handling this public health event. I do have weekly phone calls with each CEO of every hospital in the UP as we talk about how patients will get moved about throughout the region, and ultimately for the sicker patients will be sent here to UP Health System Marquette. We are actively collaborating with the city, the county, and the public health department. We currently have a daily phone call with the public health department following our command center meeting so that we can collaborate and coordinate our efforts. We are also in the process of preparing with the county and the health department a public announcement that we hope will be out this week. We've undertaken surge planning. We have plans for surging staff, physicians in the facility. We have developed an inpatient facility plan of where patients that are COVID or COVID suspect will be housed in the facility, and then a plan for the additional floors that we would surge into as the spread of the disease increased, with the goal of trying to keep them on specific floors to protect the public and reduce the potential spread. Much work is also being done around staff resiliency. This is a stressful time, both in the community and also here within the facility. So we're focusing hard now on building staff resiliency. To that end, we appreciate the support that the community has offered and welcome any cards or letters of encouragement that you would like to send into the staff, and we will display them in public places to give the staff a moment of relief and some joy as we move through this event. Ways to stay up to date. Strongly encourage you to be following the Marquette County Health Department website for updates on the number of patients that have tested positive throughout the Upper Peninsula of Michigan and the County of Marquette. Social media pages. We are updating on social media pages, the events and preparedness here at the hospital. And again, I would encourage you to look at the hospital website if you have any questions. I really want to take a moment to thank the community for their support. You know, we care for our community, and the health of the community is our top priority. We've had some amazing outreach from the community of support. Northern Michigan University stepped up very early and has been a strong partner with us on this endeavor. We've secured N95 respirator masks from Northern Michigan University and are in the process now of moving over some of their large convection ovens as we prepare for the possibility of having to sterilize and reuse N95s in the future. The organization Masks for Marquette has currently made us 1,500 masks to date. I'd like to thank the Marquette Senior High School who has used great ingenuity in developing face shields for our staff. Very early on when we identified the need for goggles for treating these kind of patients in our special part of the ED that we've isolated for seeing upper respiratory patients. Marquette High School was kind enough to bring over 200 goggles for the use of our staff. And again, also would like to recognize everyone else in the community who has been so kind in donating supplies. Finally, I'd like to say a big thank you to our team members, the medical staff, and all the first responders throughout the UP for their dedication to our patients and to the community. I want to close by please let you know that heroes work here. Thank you.